Welcome to the Optimal Bio podcast. At Optimal Bio, we don't just balance your hormones, we balance your whole body. Our conversations range from nutrition to medicine with an emphasis on wellness tips to support your health journey. If you like what you hear, find us on the web at optimalbio.com and follow the podcast so you don't miss an episode.
Welcome to another edition of Optimal Bio's Wellness Podcast. Today we're thrilled to have Mavis Jamal back with us today. Last time we heard from Mavis, she was Mavis Hodges. So before we get going, congratulations on your marriage. And why don't we talk a little marriage so far? How's it going?
Thank you. Oh, it's going. It's going great. It's a good feeling. It's a good feeling to say that's my husband.
So you got married in October?
Yep, October 24th in the mountains of Asheville. It was beautiful.
Very good. So you celebrated your first Thanksgiving and holiday season together. And was there any in-law fighting going on for the first go-around?
Oh, you know, there's always some in-law fighting.
I just remember when I got married, I don't know why I thought this, that naturally we'd always go to my house, my family's house for all the holidays. And obviously that was very short-lived, and realized right away that the first part of compromise is around the holidays. Oh, yeah.
Yeah, we definitely learned that lesson this go-round, so.
Good deal. So today we're going to talk to you about thyroid. And, this month is Thyroid Awareness Month. And, you've been at Optimal Bio for a while, and you're obviously, working with patients. And in addition to doing hormone replacement, you're looking at, doing overall wellness, and thyroid's part of that. So from I don't want to use the phrase thyroid for dummies, but from a simple thyroid ABC, why don't you just talk a little bit about the thyroid and, what it does, and, what are the complementary glands, I guess, that, are part of the endocrine system, and we'll kind of go from there.
Well, I could literally talk about this for probably 5,000 hours, but don't want to bore everybody. So the quick and dirty. All right. So thyroid, in my opinion, is probably the most sensitive hormone gland that we have in the endocrine system. It's the most sensitive because it responds to everything in our environment, our external environment and our internal environment. So it's very responsive. And why is that, Jim? Because you think about it, as we've evolved, if we're living in the tundra, which hopefully you're not, but if you're living in the tundra, or you're living in the Amazon, or you're living in the desert, or wherever you're living, you have to adjust, you have to adapt, right? If you're starving, if you're fasting, if you're feasting, if you're stressed, your body has to adjust and adapt. And the thyroid is a huge piece of that because it drives energy. It drives metabolism. It affects every cell and system in the body. So I wouldn't say it's like the best gland in the endocrine system, but it is by far the most sensitive and delicate.
And then from just a simplistic standpoint, where's it located on the body?
Right here.
So in the throat area, obviously.
Yes, if you can't see me, bottom of the throat.
And then it seems like today too, not to jump ahead a little bit, but it just seems like there's a lot of irregularities with thyroids in a lot of people, from, the young to the older generation. Why is that? I mean, is it the classic endocrine disruptors again with, the environment and, what's in our food supply and plastics and everything else? Or is there something else that's going on?
I think it's a combination of all that, Jim, right? I mean, endocrine disruptors, yes, 100%. There's also like a genetic predisposition to some of it, right? And in fact, so I was looking at a little bit of the prevalence, since this is thyroid awareness. Let's first of all be aware how prevalent this is. So the stats that I was looking at, anywhere diagnosable thyroid disease by testing, which is a whole conversation in itself, which we can get to later. But about 10 to 20% of Americans are diagnosed with thyroid disease. But it's actually estimated that about 40 to 60% actually have it, a clinical diagnosis that's not diagnosed by actual labs. And that's because there's such a range in the labs. And, again, we can get into that in a minute. But, I mean, that's incredible. 40 to 60%, that's like half the population. That's a big chunk of people.
And a lot of these people are obviously going around and they don't realize they have thyroid problems. So, because they're probably not being tested. And so what are some of the things that, one would look for? Obviously we talked a little bit about energy and, obviously if thyroid affects your metabolism as well, but, if you're just going through life and, you're working hard and, you're doing what you need to do, are you more fatigued, for example, or do you have more aches and pains? What are some of the typical symptoms that you would come across?
Yeah, so it's interesting because I've seen such a wide variety in the presentation for patients. So it can affect you from anywhere from head to toe. So yeah, fatigue, energy level, definitely a big one. It can affect your skin. It can affect your hair. It can affect your eyes. It can affect your cholesterol. It affects your ability to make sex hormones. It affects your mood, so it can cause anxiety, depression. It kind of slows everything down if it's not working right. So think about constipation, gut issues, that type of thing. It just kind of slows everything down if it's not working too well. If it's working too well and you're producing too much, then you're going to get the opposite end of that spectrum, right? Diarrhea, racing heart, high blood pressure, weight loss, right? You're going to get the opposite end.
So kind of walk us through the body in this case where, you wake up in the morning. What's your thyroid doing at that point in time? You're eating. What does your thyroid do at that point in time? What are the signals that are being sent, from different parts of the body to, trigger whatever the thyroid does to the body?
It's ongoing all the time. It never stops, right? So like I was saying, like if you're fasting, then you're going to be more in the reverse part of your thyroid. So we can get a little bit to the numbers and stuff too. So you've got, let me kind of break this down a little bit. So you have free T3, which is your metabolically active thyroid hormone. And then you have reverse T3, which is, yes, I just said free T3, metabolically active, right? Yeah. Then you have reverse T3, which is like the brake or the stress. So you've got the gas pedal on one end and the brake on the other, right? And just like anything with hormones, you want like a delicate balance, right? You don't want too much gas. You don't want too much brake, right? You kind of want a good balance. And so let's say if you're fasting, you haven't eaten for 18 hours, you're going to be more on that reserved brake side, right? Because you want to kind of reserve metabolism, right? If you're not eating for a long time, you want to reserve that. Whereas if you're feasting, you're going to want it in the other direction. So again, it's always adjusting, whether we're working out, whether we're under chronic stress, whatever we're eating, whether we're praying or meditating or whatever it is, it's always adjusting to what the body needs.
Yeah, it kind of acts like a regulator in your body.
Exactly. That's exactly what it does. I'll say it gets a little funky though when you have nutritional deficiencies or when you have those endocrine disruptors throwing everything off, when you have cortisol issues from chronic stress, or you have, low testosterone, if you have low cholesterol even, right? So there's all these things that can throw it off, but toxins and endocrine disruptors, like you said, is a big one. But it's always adjusting to our body.
All right, you mentioned some of these lab ranges before. So if you're looking at the free T or the reverse T, if you're going to a regular PA like you were before you came to Optimal Bio and you just tested for thyroid, what labs would they run compared to what we would run at Optimal Bio?
Yeah, that's a great one. Yeah, let's talk about that. So you have traditional medicine and then you have more holistic functional medicine, right? So where I practiced before, for thyroid screening, what is routinely checked is what's called TSH, or thyroid stimulating hormone. That is your brain talking to your thyroid. So specifically the pituitary gland telling your thyroid, hey, we need to produce thyroid hormone here. So a typical screening test in primary care is your TSH. That's it, which is a terrible, terrible indicator. That's our screening tool, but it doesn't tell us anything about what is your thyroid making. So at the level of the thyroid, you're making T4, which is your inactive thyroid hormone. T4 has to be converted into free T3, like I said. But like I was saying earlier, it could either go free T3 or reverse T3. Like it has an option, right? And it's going to change. But in primary care, sometimes I would order the T4 with the TSH if the insurance covered it. And so, okay, that's great. Now we know how much the thyroid's producing. But A, we don't know how it's converting. And B, that's not telling us anything about if that's getting to the cell, because it's the free T3 that gets to the cell, right? That's what drives metabolism energy. It's not the T4. So do we care about what the T4 is? Yes, but that's not the only piece of the puzzle. But in primary traditional care, you either get a regular TSH or a TSH with a T4, which is sad.
So then if your primary care lab, the one that they run is, let's say, abnormal, what is the course of treatment for that? And then how does that affect then the T3?
Well, nobody knows because they don't check it. So all of the synthetics treatments for thyroid. So, in school we were learned, Synthroid, levothyroxine, which is synthetic T4. That's how you traditionally treat thyroid disease. So you check a TSH if it's high, or if you have a T4 and it's low, and you diagnose somebody with hypothyroidism. In primary care, that's it. That's all we need to say you have hypothyroidism. We don't check antibodies. You didn't do that in primary care because we didn't care. We're going to give you synthetic T4. That's what we're going to do. And then when we follow up, we're either going to check your TSH or your TSH and T4 to see where is your T4 level and is your TSH doing what it's supposed to do. And that's it. We don't look at T3. We didn't even care about T3. So it wasn't until I started studying functional medicine that I started learning about all this. But even before then, I knew there had to have been another piece to this puzzle because I put so many patients on Synthroid and levothyroxine. They come back in, their labs change, but they didn't change. They still feel the same. And so I'm like, what's going on here? I mean, some patients, they would feel a little bit better, but most of them did not. And then some people, they just look at a lab and they're like, oh, now I'm normal, and they feel better, right? Placebo. But most just did not feel better. So I knew there was another piece that I was missing. So when I started delving in, 2-3 years ago with the thyroid and learning more about it, then I was like, oh, this makes so much sense. You have to check the other stuff.
So then you brought it up earlier about the difference between hypothyroidism and hyperthyroidism.
Yeah. Hyper just means your thyroid's producing too much. Hypo means it's producing not enough. That's it.
Okay. And then it seems to me that, and maybe you can correct me if I'm wrong, but the majority of people have hypothyroidism as opposed to hyperthyroidism. Is that a fair assessment or is that not true?
I'm not sure the actual stats on that. I've never treated a hyperthyroid patient, and I don't ever plan on it. But typically what I've seen in the past 7 years that I've diagnosed with just screening is usually hypo. Yeah, but the actual stats on that, I couldn't tell you.
Okay. And then the goal for the treatment of hypo is to turn it back into more of a hyper scenario.
No, it's called euthyroid, meaning just stable in the middle, balanced.
Right, but if it's producing less, you want it to get it to produce a little bit more.
You do, but not too much.
Correct. Right. I didn't mean to say we want to get you back into hyperthyroidism. We just want to speed it up a little bit to get you back to normalcy.
But if you do it incorrectly, you can cause that. So you really just, again, it's a delicate balance.
So Hashimoto's, which is a common malady, is that hypo or hyper?
That is hypo. And that's one of the most common disorders that we see in America. And so what Hashimoto's is, it's an autoimmune disorder. So autoimmune meaning our own immune system is attacking ourselves. It basically gets confused. So our immune system has always been to protect us, right? That's what it's supposed to do. And that's what it intends to do. But sometimes it'll get a little bit confused, which could be a genetic predisposition that we have a gene that makes us more apt to getting it confused. So for whatever reason, it gets confused, and then our immune system makes a protein, an antibody, and that starts to attack our thyroid tissue.
And then how do we combat that?
I could talk another hour on that.
We got plenty of time, so.
With autoimmune disease, and again, just to clarify for anybody who's listening, you can have hypothyroidism without having autoimmune Hashimoto's disease.
So that's a great point. So how do you know, though, what the difference between traditional hypothyroidism and then Hashimoto's?
By checking the antibodies and looking at the labs, which again is what we do here at Optimal Bio. So we check a TSH, a free T3, a free T4. We look at your reverse T3, and then we check 3 antibodies that could be attacking your thyroid. And we also look at some of the ratios to kind of optimize some of those functions. But it's critical. So, back to my point about primary care, not to get off tangent here, but when I would diagnose with hypothyroidism, we didn't check anything else. That was it. So, and that's so even if I'm throwing a hormone replacement at someone, I'm not treating the root cause, right? If someone has an autoimmune disorder, you have to attack the antibodies. You have to get the antibodies down, because if you don't, you're not treating it appropriately. So a lot of people go misdiagnosed and undertreated for years. So fast forward to what we do here. We do a full extensive thyroid panel to see, because we need to know. The treatment for regular hypothyroidism varies. It's different, right? So if you have autoimmune disease, it's a different treatment. So with autoimmune disease, it's kind of like three prongs here. Typically, you have a genetic predisposition, typically. Then you have a trigger, some sort of trigger or toxin or stress or something that, triggers the body. And then you have inflammation. So inflammation or leaky gut, which a lot of times the inflammation is in the gut. So there's like three different things that all kind of have to happen to complement each other to cause this autoimmune disorder in the thyroid. So what we do is, one, we want to attack the inflammation. So we got to decrease inflammation in the body. You can do that with diet, lifestyle, supplements, and certain medications. Obviously, if someone has gut issues or leaky gut or celiac disease, which is also a common trigger, you want to obviously address that. Gluten is highly inflammatory for the thyroid, and the thyroid does not like it. So if anybody has thyroid issues, I'm always telling them, cut the gluten out. There's other triggers too, but that's a big one. And then basically we're just supporting the thyroid with the nutrients that it needs. So zinc, selenium, iodine, vitamin A, vitamin D, iron, B vitamins, vitamin C, all the things that the thyroid needs to do its job well. Because a lot of the times we'll see, patients making a decent amount of T4, but they're not converting well to T3. So, and there's different patterns with thyroid. I love thyroid. I could talk about thyroid all day. But anyway, there's different patterns with thyroid. And so basically you identify the pattern, and then you address the root cause of that pattern. And we basically treat based on what we're seeing clinically as well as in the labs. But definitely autoimmune is treated much differently than just regular hypothyroid, which is why it's important to get your labs checked.
Yeah, you brought up I think a scary scenario previously where patients go in, they get tested, but they're only being tested for one thing. And they go on these synthetic medications and they don't feel any better. So eventually, because they don't feel any better, they continue to go back to the doctor. Then eventually they get probably kicked over to an endocrinologist. And then hopefully they finally run the appropriate tests, and then hopefully put them on a treatment plan that makes them feel better. While they're doing that though, is there any increased damage or any, can the autoimmune piece of it become more acute, as it goes untreated for over time?
Over time, yeah, for sure. Yeah. And it is scary, right? And so that when you were saying that made me think about a story. So I don't know, 10 years ago or so, this is just a story of traditional medicine. So I had an elevated antibody, and everybody I went to see, they're like, we have no idea why this antibody is elevated, blah, 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 blah. Anyway, so I ended up bouncing around seeing an endocrinologist, a couple of rheumatologists. Anyway, one of the rheumatologists finally, none of them had an answer for me. Right, none of them had an answer. But I'll never forget, this one rheumatologist looked at me and she said, well, you don't have an issue now. You don't have a disease now, but I think you're at an increased risk of developing an autoimmune disease some point in your life, and most likely it'll be thyroid. And that's all she told me. And I was like, oh, that's fantastic. That's really what I want to hear at 19 years old, right? So
yeah, plus what do you do with that?
Yeah, and that just always sticks with me. Well, that's why I've always been driven to learn more and educate myself, right? But that just always sticks with me, because that's exactly what traditional care is. It's like, it's waiting for the bomb to blow and then try to look backwards and figure out where it came from and then just slap a Band-Aid on it, right? Whereas what we're doing here, that's functional and holistic, we're trying to catch these antibodies before they turn into Hashimoto's, right? Because if someone has a predisposition for that and they have if they're at risk for that based on their labs, they're a ticking time bomb for autoimmune disease. All they need is one infection to set something off, or a little bit of inflammation, or a little bit of stress to set it off. So we're just being much more preventative and thorough, and not saying, oh, well, you're probably going to get this one day, but we'll just sit here and wait for it to happen, then we'll treat you.
So let's go into a little, scientific, technical dive for a minute or so on the actual antibody test. So, when one gets an antibody test, usually the number comes back out and says, greater than 30, less than 30. There's a range in some cases where the range may be anywhere from 30 to 150. And let's say somebody's antibodies are in the 30 to 150 range. Let's say they're at 60. And it says normal, right? Do you view that response from that lab as normal? Or do you look at it and say, man, you got a lot of antibodies that are fighting something in your body at this point in time. So, if you were at 31 and the range is 30 to 150, then yeah, you're better. That's the better normal than being at 60 and normal. So can you walk us through that whole antibody thing and the thought process where when you look at something, somebody like me might say, hey, I'm normal. I got my thumb up. And you're like, yeah, you're normal, but, you're producing antibodies, which in some cases may not be that great, right?
Exactly. Yes. And so, yeah. So there are these ranges, okay? And speaking of ranges, before I answer your question, there are optimal ranges and then there are normal ranges, meaning this is what the average population is. Again, the average population that potentially 40 to 60% have hypothyroidism, this is what's normal. Okay, so what we look at here is we're looking at optimal ranges, not what the average population is, especially given that the majority population is not well. So one, keep that in mind. But two, when it comes to antibodies, there are different cutoffs, right? And it drives me nuts because it's like, oh, well, do you just have like a little bit of Hashimoto's or do you just have a lot of it, right? And so it's like, yeah, that drives me nuts. And our optimal ranges are different than the LabCorp's. So, and it's not off by a lot for Hashimoto's, but it is a fine line. So I always go back and forth with like, how do I explain this to patients? Because, they're like 5 to 10 points off from me saying, yes, you have an autoimmune disease, right? And in practice, I've seen people reverse autoimmune disease with diet and lifestyle and hormone replacement therapy or whatever they need. I've seen this. So I know that it can be done. So it's like a spectrum. With autoimmune disease, it's like a spectrum. So on one end, you have Hashimoto's. On the other, you have Graves. So Graves' disease is when you have a lot of thyroid hormone going on. Hashimoto's is when you have too little, right? People can swing on that pendulum. So some people will have Graves and then they'll have Hashimoto's, or they'll go back and forth. And so when it comes to a specific number, yes, it's hard to explain and it drives me nuts. But people can change very quickly from one extreme to the other. But regardless, if you're producing any amount of antibody, to me, that means, hey, something's going on in the body. Something's irritating your thyroid. Let's try to figure out what it is.
But realistically, though, you're never going to be at zero. For example, for antibodies, you're always going to have some antibodies that are in your body.
Some people will be undetectable, and then some people will just have a little amount. Yeah.
But in your case, if let's say, just hypothetically, I'm just making this up, but the range goes from 3 to 10 as the normal, and somebody's running in there, somebody's around 8, from a lab perspective. You would look at that and say, hey, you have Hashimoto's, or it looks like you got some inflammation and you got some other things going on there that you need to correct. So we know you look at the whole picture, but at the end of the day, from a normal range, if, somebody's around 4 out of, from 3 to 10, and the other person's at 8 from 3 to 10, they're technically normal, both of them, but one is rolling an 8, one is rolling a 4. So then you're saying, I would think, based on what you said before, that the 8 patient really should be mitigating some things to get that number lower again from an antibody perspective.
Yeah. And then I also look at their family history too. So if if they have an increased risk from a genetic standpoint, potentially, those are the people that need to work much harder to prevent these things, right? And then you look at their other health problems. If they have gut issues, 9 times out of 10, they're going to have thyroid issues, right? we can talk about that too if you want. I love talking about the gut.
We're going there next.
But yeah, so you just kind of look at the whole clinical picture. If someone's having symptoms, I could care less what their number is. Like, I'm going to, go full force, right? So yeah, it's definitely part of the puzzle, but that's why medicine is so fun. It's like an art. Obviously there's a science to it, but it's really more of an art.
So you talk about symptoms, and I know you have to be a psychologist and an artist and a trick questioner in order to get a true sense of what the patient's going through. But it kind of reminds me when you go to the doctor sometimes and they give you that little stupid pain thermometer. 0 is no pain and 10's, out of this world. And I'm thinking to myself, this is a totally subjective test because pain is totally different for a lot of different people, right? So my 1 might be somebody else's 6 or vice versa. So when somebody's saying, man, I feel great, I'm not really symptomatic, what do you do? How do you dig deeper, with a patient?
So are you saying if someone's labs are really wacky, but they're like, I feel fine? Is that what you're saying?
No, I'm saying that they, maybe they're quasi wacky, but they're not like wacky. And, that person's like, yeah, I'm a little tired, but it doesn't affect me in my life. Like I'm doing everything I want to do. I don't have any issues anywhere. I run hard every day and, I'm good, but I can't stay awake till 10 o'clock. I have to go to bed at 9, but I'm okay because nothing else in my life, is down. But you're looking at the lab and you're like, yeah, but you're looks like your antibody is a little bit high and, you're kind of borderline at this point in time. So how do you get the patient, I guess, to really be more sensitive to their symptoms?
I think a lot of that is, you've heard the saying, mind over matter, right? Mental fortitude goes a long way. You could have crap hormones, but still have drive and determination and willpower stronger than anybody else. So I think a lot of it is just mental, right? And so it's for me, from that perspective, I would just focus on like, okay, what are the patient's goals? And then I would try to get them to be more self-aware and then kind of gear the treatment towards their goals because they need to be invested in what they're doing. If they're not invested or motivated, they're not going to make changes, right?
Correct. And the fact that they're there, I guess, is, indicative that they do want to make a change.
You hope so.
Talking to you, nobody's going to bed at night thinking about coming in to see you every day about thyroid, right? Most people don't want to see doctors. So let's pivot to gut. Gut seems to be, I'm going to play devil's advocate a little bit here. Everything you see and read these days is, gut. It's like one person started talking about gut, 10 years ago. Now it seems like the whole world in the podcast world is talking about gut these days. So, well, of course, man. Peter Attia, Dr. Brannon, Sean Baker, everybody that we've been exposed to talks about gut. So anyhow, tell me how first off the gut correlates with the thyroid, and then secondarily, is the gut being overplayed these days?
No, the gut is not being overplayed these days, okay? And in fact, I think we've been talking about gut for a long time, but I think you just hear more about it now because of the growing amount of research that's coming out. And it's like things we knew before, but again, it's just the more research you get, you're just like that kind of solidifies everything. And then it just takes time to get it to who it needs to get to, right? That information. Oh God, again, I could just talk about this forever.
Yes, there's a lot of stuff coming out, but if you go to a traditional doctor still, very rarely are they doing a food assessment and talking to you about gut still. So it still has not hit mainstream medicine yet. Not
mainstream medicine, but so like I'm studying through the Institute of Functional Medicine. It's there, but it's not handed in medical school, right? Or PA school or wherever you go. It's not part of that traditional medical curriculum. But if you seek further education, like I've done, then it is there. So depends on, yeah. But yeah, if you go to a traditional, well, depending on where you go, but typically if you go to a traditional office, they're not going to be like, hey, let's talk about your gut. Yeah, exactly. Yeah. But no, to answer your question, so wow, I could talk about this forever. There are so many things that the gut does. But I think with respect to the thyroid, well, let's talk about hormones for a second, because your gut health and your microbiome and hormones are like brother and sister, right? They're either getting along or they're not. So you have to have good gut health, a good microbiome. Microbiome means all of the balance of the bacteria and the even maybe parasites. I don't know, whatever you have in your gut. There's fungus, I don't know. There's a lot going on in there. So there's like this, again, it's about a delicate balance. So you could have too much bad bacteria or sometimes too much good bacteria. And anyway, so that's what I mean by microbiome is all the living things inside of your intestines. So all of those things affect your ability to make hormones, not just sex hormones, but we're talking about brain hormones. It affects your ability to break them down. It affects your mood. So all of those things also affect your thyroid. But I think the biggest thing for thyroid that we see is anytime you have inflammation in the gut, which could be from numerous amount of things, or even if you have leaky gut, which seems to be the most common thing that we're seeing in America. And that's because our food is not great. And that's saying it nicely. So our food supplies are not great. We're so inflamed. We're so toxic. We're being exposed to chemicals. Our drinking water, if you're not drinking filtered water or breathing fresh air that hasn't been polluted. I mean, there's so many things we're exposed to, and stress is one that can cause leaky gut too. So it's an endless list. So most people to some degree probably have leaky gut. So what the heck is leaky gut? So leaky gut is when the lining of your intestine, because it's like a tube, right? From head to butt. Does everybody get that? Okay. There's a tube. So the lining of the tube is supposed to be very strong, very strong. Nothing should be able to get through that shouldn't. It should be nice and lovely and have great amounts of bacteria and the good ratios, and it should just be a happy place. But when you have leaky gut, there's inflammation and there's literally leakiness. So it kind of looks like this, right? It's not like this, it's like this. So things are getting through that are not supposed to get through, right? So if you have proteins coming through that's not been digested and it's getting into your bloodstream, then your immune system starts attacking that. Why? Because it's not supposed to be there. And that's what the immune system's supposed to do. It's supposed to help protect you. So it starts attacking these proteins and making antibodies. And it also triggers this whole inflammatory cascade in the body, right? So I feel like when it comes to thyroid, that's one of the main drivers. But again, there's so many things that cause leaky gut. And then you have this inflammatory process, and then you have these antibodies that then can turn into full-blown, autoimmune disease that affect many tissues in the body.
So you talked about leaky gut. How do you know you have leaky gut?
There's tests for it. So there's blood tests you can do. There's poop tests you can do.
Well, okay. So, you do a stool test and, it comes back and, it's showing some abnormalities, and then, where do you go from there, right? You start testing for gluten intolerance and everything else, so then if you saw somebody did that test and, you thought there might be a thyroid issue, would you just jump right away to do a thyroid test?
Probably would have already checked their thyroid.
You would have, all right.
Yeah.
That's first before that.
Yeah,
okay.
Yeah.
All right.
Probably, yeah. Yeah. So anytime you see a patient that has thyroid issues, you want to think, okay, is there anything in the gut going on? And like I said, anytime anybody has Hashimoto's antibodies, I always tell them to cut gluten out. When it comes to Hashimoto's, gluten and dairy are the two biggest triggers that can trigger Hashimoto's. Typically, like I said, there could be other food triggers. So people could be sensitive to anything. Like I'm sensitive to eggs, which is, I hate that because I love eggs. But everybody's different, right? So unless you get a test to figure that out, or do an elimination diet to figure that out, which is actually the best way to do it, you won't know. So everybody's sensitivities or allergies may be a little bit different, but typically speaking, the data shows that gluten and dairy are the two biggest triggers for thyroid autoimmune.
So let's talk about Graves, because I you hear that a lot, but it seems like it's, I don't know if it's less diagnosed or it's just not maybe it's treated differently or whatever.
Totally different treatment. Mm-hmm.
And, you mentioned a lot with autoimmune and Hashimoto's, food playing a part in potentially healing or reducing the inflammation. Does food also play a part on Graves as well?
I mean, it has to. And to be honest, I've never treated Graves, but just thinking about it logically, it has to, right? Because at the end of the day, your thyroid still needs the same nutrients to do its job well, right? I mean, it needs to regulate. That's what it's supposed to do. So for example, like iodine. So, I was just reading the last stat I saw on that. It was estimated that about 38% of Americans are deficient in iodine, which is pretty incredible, right? And iodine is critical for thyroid function, right? If you don't have adequate iodine, you're not making enough T4, and then you're not able to convert to T3, right? And so it all comes down to nutrients and your diet and getting the right nutrients so that your thyroid can perform in the way it would. So although hyperthyroid has a different treatment, at the end of the day, you still need the same nutrients for your thyroid to work the way that it's supposed to work.
Okay, that makes sense. This dairy. So what is it in dairy? Is it the enzymes in dairy? Is it, is there something particular within dairy that are the impurities now where they've, homogenized and pasteurized everything to the point where there's no nutrients left in dairy? What is it about dairy that triggers, thyroid issues?
So with respect to autoimmune process, again, it all just goes back to the leaky gut, right? So if our gut was strong, these proteins should not be getting through. But since they're getting through, that's when the immune system starts to attack it. So it's not that there's necessarily anything wrong. Well, I could go on about conventional dairy, but there's not anything that's wrong with the actual substance itself. It's just that it's getting in the wrong place, and then our immune system is causing that inflammatory cascade.
Just jumping back to iodine real quick, what are some of the foods that are richer in iodine?
Seafood is a really good source for iodine. But the thing is, and then we know we're not getting it enough in the food supplies because it all has to do with the soils. And you can actually look at a map online, and it's called like the goiter belt. And you can see like what areas of soils have sufficient iodine. But how many people do you know have a garden in their backyard and are eating food out of their soil? Right? You're usually getting it from, well, me too, but you know what I mean. Jim, we're not normal.
Yeah, my wife has got a great garden in the summertime.
I love that. But yeah, so the truth is, and there's other food sources for it as well, but we're not getting it like we were before. And again, it depends on your soil content, depends on where you're getting your food. If you're getting food from a grocery store, how long has it been since it even touched the soil? It's been all washed off, especially if it's not organic. You're getting chemicals with it too. So we're just not eating food from the ground.
And also, I think up until the early 90s, iodine was in bread, and now it's been replaced. Oh,
yeah. Not only are we getting enough, but then we've been exposed to things called bromides. So yeah, you're talking about the bread. So they took out the iodine, put the bromides in there. But we're not just being exposed to bromides in water and food, because you're talking about chlorine, fluorine. Chlorine, fluorine, these are bromines. So it's in our water, it's in our food, it's in flame retardants, which is in everything you buy, unless you buy non-toxic furniture, which, costs an arm and a leg. Worth the investment, I must say. But yeah, so we're being exposed to all these bromides, which is displacing iodine, right? Because they competitively inhibit for the same receptor, the bromides and the iodine. So yeah, that's another part of it. Again, it's that environmental aspect in addition to the change in the soils and the change in the diet and how we're eating processed foods and yeah.
So a little side note here. I saw the other day somebody had mentioned that kale is not good for you. What are your thoughts on that?
Again, it all comes down to your gut microbiome. I know I keep saying that, but that's literally what it comes down to. Because you think about it, wherever you grow up and eat from, because technically we're supposed to be eating out of the ground where we came from. This whole getting your grocery store and getting your groceries delivered, that's affecting our microbiome. But naturally, you would be eating food from your natural environment, and that's going to shape your microbiome, right? So some people can't handle kale. Some people can. I mean, it all goes down to what are your genetics? What were you made to eat based on your ancestry, right? Because everybody's different. And then where are you living and where are you getting your food? So I don't ever like to say a food is bad or good. It's just some people aren't supposed to eat certain things and some people can do fine with it. Again, it's about balance, moderation, right?
Yeah, true. But are you saying that if your ancestry came from, let's say, England and France, that you're then more susceptible to a diet from that region than, let's say, you trying to get on a Greek diet, with foods that are coming from that part of the world?
I believe your genetics and your ancestry plays a huge role in what your diet should be. Yeah, for sure.
So if I came from Ireland, should I just eat potatoes all day?
I had potatoes and cabbage today for lunch. That made me think of that.
It's a great probiotic, that cabbage.
And there's a lot of genetic testing now. So nutrigenomics is actually something I'm really interested in. And what that is basically looking at your genetic makeup and figuring out what is the best things for you to eat. Now, again, there's that huge environmental piece that's going to change your genetic expression. We know that food changes our genetic expression. So just because your DNA says this doesn't mean that's the phenotype you're expressing or that's what's actually happening. So you really have to look at environment and your genetics to really figure out what the best diet is for you.
Okay, so for thyroid, autoimmune, Hashimoto's, real quick, if you had to recommend a diet, what would it be? What kind of supplements would you take? What kind of exercise would you be doing? Kind of walk us through a little, quick and dirty, plan for someone with autoimmune.
There's like a basic package, I will say, that everybody should be on. But then outside of that, again, it's very individualized of what should happen. But, if they have autoimmune, you want to attack inflammation. So you want to have a very, whole foods diet, not a lot of processed stuff, not a lot of sugars, not a lot of alcohols. Please give up the gluten, dairy if it's a trigger for you. And then, find out what your food sensitivities are. There's really great tests you can get now, or you can do an elimination diet, which takes, a few weeks, but it's the best way to do it. Supplements are important. So like I was saying, iodine, very important. Zinc and selenium, those two are needed they actually help the enzyme that converts T4 to T3. So if you don't have adequate amounts of those three, those are my three favorites, zinc, selenium, and iodine. If you don't have adequate amounts of those, you're not making enough T4 and you're not converting enough to T3. So I always recommend supplementing with those three at minimum. And then, inflammation. So if you've got inflammation, fish oil, I like to recommend fish oil a lot. But there's all types of natural anti-inflammatories you could take. If they have gut issues, you want to assess that. But baseline, you really want to attack inflammation and zinc and selenium and iodine and vitamin D and iron. There's so many, I keep going. But those are kind of the main ones that I look at initially to say, okay, these are what you should supplement with. These are the foods you should be eating or not eating, more importantly. And then outside of that, it's just very individualized based on what the patient wants. I mean, as far as exercise goes, obviously you want to be active. Exercise helps any hormone issue with sensitivity. So you can have hormone resistance, whether that's insulin resistance or thyroid hormone resistance or whatever it is. What that means is here's the cell and here's the hormone. Okay. The hormone wants to attach the cell and talk to it. But if you have resistance, then the cell is going to be like, nope, we're not hanging out today. And then it's not allowed to connect. They're not allowed to communicate. They're not allowed to talk, right? So exercise helps with that across the board, whether that's hormone related, insulin, or whatever it is. Exercise helps that cell be more sensitive to receiving the input from the hormone. Vitamin A is also very effective for that. Vitamin A is tricky to supplement in some people, especially women, because it could affect fertility and things. But think about your red, orange vegetables. And also like collard greens. So those are some good examples of vitamin A. But there's so many different ways to approach it. But those are kind of the main nutrients that we focus on as a minimum. So
what's the synergy between testosterone, estrogen, and thyroid?
Oh my God, that's a big thing. So, so let's back up to the adrenal glands, because that's kind of like, some people call it like the mother of the hormones or whatever, which some people would disagree with that. But so your adrenal glands are located on top of your kidneys. They secrete a bunch of different hormones. They secrete a lot of sex hormones. They also secrete your stress hormones. They secrete a lot of things. But if your adrenal glands are not working well and you're not secreting these hormones, you're automatically not going to produce good thyroids, right? Because you need the sex hormones, which is what we specialize in here, to have a optimal functioning thyroid. And in fact, I just saw this guy earlier today, and within 6 weeks of starting the testosterone therapy, his T3 went from 2.2 to 3.4. That's amazing. And all he didn't do any of the supplements I recommended. All he did, except for vitamin D, all he did was take vitamin D and start testosterone. Think about how great he'd be if he did the other ones, right? But that's just how strong of a connection it is. So when you look at the adrenal glands, that's why stress management is so important. Because if you're pumping out a lot of cortisol because you're stressed, that's taken away from your body's ability to make your sex hormones, which makes you feel good and supports your thyroid and all these other things. And then, I don't know if you asked about estrogen, but let me talk about that.
I did. Mm-hmm.
Okay. So estrogen, one of the most common things we see here are estrogen dominance, meaning people either have too much estrogen or they're not breaking it down well enough, or it's imbalanced or whatever. So if that's happening, that's actually decreasing your body's ability to convert T4 to T3, the free T3. Remember, that's what's driving metabolism. So too much estrogen is hindering the thyroid, right? So again, it's all about this balance, right? So low hormones can affect it, high hormones can affect it. We need to find this happy medium. And then also you need a good amount of T3, a good amount of thyroid hormone in conjunction with cholesterol. That's why cholesterol is so important, to go into the cell and make your sex hormones in the mitochondria. So they're all connected. They all need to be flowing very nicely and balanced. And I always tell patients this, I was like, they're like friends. If one's not happy, the other one's not happy. So if one's off, they're all going to be off. So they're all connected.
Why don't we talk a little bit about cholesterol then? For the audience again, what does it actually do, and why is it better to have more cholesterol than less cholesterol?
So cholesterol, going back to hormones specifically, cholesterol literally turns into something called pregnenolone, which people also call the mother of all hormones. Why is that? Because if you don't have cholesterol and you don't have pregnenolone, you can't get converted into any other things like progesterone, testosterone, estrogen, right? Because that's where it comes from. So if you're not producing enough cholesterol, you're not producing enough hormones. It's just 1 + 1 = 2, right? Cholesterol is so important. It's important for the structure of the cell integrity. Fat. We need fat. We need cholesterol. It's so important. It literally affects every cell in the body. So I can't say that enough. But yeah, as far as hormone synthesis, it's the foundation. You've got the cholesterol, you've got testosterone, you've got your thyroid, all working together to produce energy in the cell in the way that it's supposed to. If you don't produce energy in the cell's not working, it's not functioning well, then you can have mitochondrial dysfunction and all these other things. So yeah.
And then where does progesterone fit in?
So pregnenolone turns into progesterone, and then from there that turns into testosterone and estrogen. But as far as, what do you mean? Do you mean what does it do in the body? Is that what you mean?
Well, that, but also don't some people with thyroid take progesterone?
If they're not producing it, because if you have low functioning thyroid, you may not produce enough progesterone. And that's one reason why having your thyroid stabilized is important for fertility, right? Because you need a certain amount of progesterone to maintain, not just to get pregnant, but to maintain a pregnancy, a viable pregnancy. So yeah, it's all connected. Mm-hmm.
All the more reasons to make sure your hormones are always in balance, right?
That's right. And it's a full-time job.
So getting back to the optimal levels of T4, T3, and other markers, from a numerical standpoint, if you can articulate it, what is optimal compared to what is normal if somebody were to be tested the same way that we test at Optimal Bio?
So what is optimal? So LabCorp's range is like pretty big for thyroid. And it's interesting because, I've only been doing medicine for 7 years, but even in my short time of doing this, I've seen the TSH change. It's just interesting, the range for that. But typically, like a traditional thyroid panel will say anything between like 0.5 and 4.5 is normal. Optimally, though, it should be somewhere probably between 0.5 and 2, no greater than 2, less than 2, right? And what's interesting is when someone's pregnant, and you got me thinking about pregnancy now. When someone's pregnant and has thyroid disease, where do they treat their TSH to? Do you know? It's a quiz.
I don't.
Less than 2. Okay, so doesn't that tell you like, if a woman is pregnant, we have to do this. But yet, and I just had a patient the other day, she was like, well, when I had my baby, after I had my baby, they switched me back over to the other med because, they were like, it's different because you're not pregnant now. Like, what? So anyway, if it's supposed to be that way in a pregnant lady, shouldn't that seems like optimal health to me. But anyway, so that's just one example. But, the ranges, they can just drive you nutty. But yeah, so definitely below 2. And a lot of people, speaking of TSH, a lot of people get freaked out when the TSH goes low. And again, LabCorp, I can't remember the exact ranges of what they say is low. But technically, what is considered TSH suppression is anything less than 0.03. Okay, and that's a pretty small number. So sometimes we'll have a patient and they'll get to 0.3, let's say 0.3, because the cutoff is 0.5. And they'll be at 0.3. Their numbers look amazing. They feel amazing. They're not having any side effects. But they're like, my primary care said my TSH was too low and that you're over-treating me. No, if you look at the clinical studies for TSH suppression and for long-term outcomes that are negative, which can be if you suppress the TSH too much, it can affect your bone mineral density and cardiovascular stuff. It's 0.03. That's what all the studies say. So I don't care what LabCorp says. I'm going to look at what the studies show. So people will freak out when they see that. But, again, it's about the science. Let's look at what the studies show, long-term data.
So we talked a lot about, the physical symptoms with thyroid disease, where if they go untreated from a long-term perspective, what potentially can happen to the body? Does cancer form? Is there heart health issues? If it goes unchecked for too long, what normally happens?
A lot of things, right? Cardiovascular coronary artery disease is a big one when it comes to thyroid. But yeah, and you think about it, anything that affects metabolism, right? So if your metabolism's not running well, that could theoretically increase your risks of cancers. I mean, why not? It's metabolism. Coronary artery disease is a huge one. You're probably going to become obese. And then we know what everything is correlated with obesity. Cancers, heart disease, blah, blah, blah. And you're just not going to feel well. And then when you don't feel well, you get depressed. And then when you get depressed, it's like this cycle, right? So long term, it's just the symptoms will just get worse and worse and worse. If your bowels are slowing down, you're not pooping. We all know how that affects the hormones around here, because then your hormones start backing up and it literally affects every system.
Anything else you want to share as it relates to the thyroid? Oh, one question. A lot of people say, and they don't dismiss it this way, I'm paraphrasing, and so I don't mean it to sound like they don't take it seriously, but you can live without a thyroid.
Well, yeah, if you take hormone replacement. Right.
So, some people go through things and they're just simply not getting better than, some people might think rationally or irrationally, well, what's the big deal? Because at the end of the day, if I don't have a thyroid, I can just take medication. I can regulate myself. So I'm paraphrasing. I'm being somewhat dismissive, but for those that don't have a thyroid, what do they have to do?
They have to take hormone replacement therapy. I mean, if they took out the whole entire thyroid and they have no thyroid gland, if you don't take medication, I mean, you're not going to live, right? So it's like you have to.
Right, but when you say hormone replacement therapy, you're talking about, I interpret that as testosterone, but there's a lot of people that don't do that. They just simply take medication.
Okay, so when I mean hormone replacement, I'm talking about thyroid hormone replacement.
And what are those medications?
So there's a lot of them. So you've got your synthetics, which is what, traditionally is prescribed, synthetic T4. So that's like your Synthroid, your levothyroxine. Then you even have synthetic T3s, which some people do add on because they realize that the patient needs more than just T4, they need T3. And then you have your more natural medications, like the ones that we use here, the natural bioidentical ones. And typically the ones that we use have both T4 and T3, pretty close to the same exact ratio that we produce in our body. So it's like literally the most natural, next best thing you can get to what our bodies naturally produce. And that's what we use here.
And how often should one test their thyroid?
It depends on what's going on. If you're trying to adjust their medications and get them to a good euthyroid state, it might be as frequent as every 6 weeks to 2 or 3 months. Once they're on a more stable rhythm, you're looking at more like 6 to 12 months, depending on how stable they are.
And what about somebody who hasn't had any thyroid issues in the past? Is there just running labs every 2 years to check your thyroid important thing to do, or do you only just check it once you start feeling like you have some symptoms?
That's a great question. And I don't know if I know the right answer to that. But I would say for preventative purposes, once a year is not bad. I always tell patients if they have any predispositions or any family history, you got to get checked once a year. Like you have to, right? Because if you know you're at increased risk, then you need to do it. Other people who, don't have any risk factors, they don't have, any risk of family history or any of that, it depends on their symptoms, right? I mean, if they're having symptoms, we want to look at it. If their thyroid panel is beautiful and then they feel great and they don't have any issues, then maybe they don't need it once a year, right? I mean, I guess it just depends on the person.
We asked our guests to leave us with 5 takeaways. So you know how this works. So
get outside and get your vitamin D. Super important for the thyroid. Stress management, super important for the thyroid. I do tell people this sometimes. Even though you may be very stressed, stress is a perceived notion, right? Because your body doesn't know what stress is. You tell your body what stress is. So I always tell people with thyroid issues to kind of decrease their stress, practice mindfulness, practice meditation, do something to trick your brain to thinking you're not stressed because your thyroid's going to respond to that. The mind is a very powerful thing. So that was a long number 2. 3, eat a balanced diet. Eat a balanced diet because if you get all the phytonutrients in the diet, you're going to get all those minerals and lovely things that the thyroid needs to produce. If you're going to eat the same thing consistently, you're probably deficient or lacking in something. Number 4, if you have any symptom and you go to the doctor and they tell you your labs are normal and you don't feel well, don't believe them. Keep digging, keep searching, get a second opinion, a third opinion, whatever you need to do. Find a more holistic provider, functional medicine, wherever you are, and get to the bottom of it because you're not crazy. And where am I at? I'm at 5 now.
You're number 5, yeah.
I guess just be active every day because, again, when it comes to thyroid health and cellular sensitivity, if you're not moving, you're not moving, and that's not good. Your body needs to flow. So just try to be as active as much as you can.
Mavis, it's been a treat as always. Thank you very much for your insights and your knowledge. And we look forward to having you back on another topic someday.
I'm excited. Thanks.
This has been a production of Optimal Bio. Optimal Bio is CEO Tyler Brannon, podcast host and partner Jim Baker, medical director Greg Brannon, production assistance by Core Media, Beth Grabencourt, administrator, Kevin Duthu, executive producer. The podcast can be found on our website, optimalbio.com, on Apple Podcasts and Spotify. Our theme song is Sunwave by Paradiso, provided by Epidemic Sound.